systematically, but I'll do inspection, palpation, and range of motion at the same time on a system and then move to the next one. If you'll remember that your extension flexion degrees normal for extension would be 55, flexion would be 45. That's probably one of the 5 questions that Bill or I will have that we can ask you guys.
Do that one more time. It was what?
It's on your sheet of paper, but it's extension and flexion, 55, and then 45 for flexion. If you will take a look at me. So right now I'm inspecting the skin in his head, looking for any lesions, any nodules. There's no erythema to note, no bulges. As I look at his neck, I don't see any of the vasculature, any JVD that's noted at this particular time. If you could, we'll do passive range of motion first, and then we'll test muscle strength. And so if you could extend your head back, flex your neck forward. If you could turn to your left, turn to your right, and then if you could flex your head back again against my hand, forward, to the right, and to the right actually. There you go. And so his strength, muscle strength was appropriate. Did not note any bulging. Was there any pain or tenderness with active or passive range of motion? So no pain or tenderness noted with range of motion. We'll move to his shoulders. And so this may be the time where someone may have on a gown. You can either move their shirt or take a look. Go with an inspection. I don't see or note any nodules here. Is this painful at all? And then with the shoulders, what you want to be careful with is making sure that folks don't have any fluid there. And then you always want to check that AC joint as well. And so then to make sure that before you start to have them doing range of motion that there's no issue or concerns there. If you could lift your arms straight out in front of you. And then if you're able to push both your arms back behind your body. And then if you could, for me, take your right arm and internally rotate. Okay, and then if you could do the same with your left arm. Good. And then with your left arm, if you could really rotate. And then do the same thing with your right hand. Is there any pain or tenderness there as well? Okay. And then you can lift your arms out in front of you again and hold against my resistance. And then push down. And then if you're able to move your arms out, up to above your head, bring your hands together, back down. And then if you're able to bring your arms out again with resistance against the arm. Okay, good. You're being nice to me. The big piece there is you want to make sure that there's no crepitation on that note there. We'll move to the elbows and then down to the wrist and hands. You'll want to make sure that as you're looking at the elbow that again you don't note any fluid. You're looking at the L-crane processes. This is an area where you may note folks have fluid or what someone may call tennis elbow as well. You look at that L-crane process, and then if you can, holding your elbows in, first, palms up, bring your arms in, and then back down. Any pain with that? Push down, palms down, palms down. Okay, good job. And so you may note that someone may have synovial fluid. That's a good joint for us to use for someone to have pain in. In particular on your exam. And And you'll just note that there were no effusions, no swelling, no nodules. When we begin to look at his wrist, inspecting for any edema, nodules as well, and then let me know if any of this is painful for you. Again, maybe a good opportunity to give someone a card that says you're having pain in your hand or one of the phalanges or so.
Are you making sure to palpate each individual finger?
Yep, I'm trying to make sure I palpate each hand bone, each phalange as well. Is this tender at all?
No.
And then if you could hold your wrists together. Do you have any pain or burning sensation? If you could hold that for 60 seconds for me.
And this is Fallon's test, correct? Okay.
I was doing this earlier and I did have tingling.
You did or didn't?
Later, I did later.
What'd you used to do?
Well, I cook now, so
Oh.
there's a lot of strain on my wrists. And
Okay.
hands.
Okay, so then from there, we'll actually tackle the median nerve, and with that, you just want to make sure that there's no pain or burning as well.
And that test is called
Tenels, Nepalito.
Mhm.
And you would see that test done for folks that may have some carpal tunnel syndrome, is what you would want to note.
And that's
there.
for the median nerve. so-
Mhm, median nerve. Then as we move down and through, we will have you lay back down, and we'll test your hips and your knees, and then I think we're pretty much done with the,
what about thoracic lumbar spine.
I'll have them stand up and we'll test flexion and
Okay.
extension there.
Where did I put that?
Because that was left
That was
off
the
for
It's at the
shoulder.
beginning.
On the sixth, did I? Okay,
It's on the rubric. Right after head neck.
okay. So we'll get that. But with hips, while you're laying down, and you can do one leg at a time, if you will hold your left leg up for me, straight out.
As far?
Bring it up as high as you can there. That's the flexion of the hip. Can you go any further on your own? No?
Mhm.
Okay. And then bring it back to the bed. Right leg up. Bring it all the way back up. As far as you can go. Do you have any pain in your hips there?
Mhm.
And then if you'll lift this leg up and press against my hand. Good job. Left leg. Good job. Press on the gas. Press on the gas pedal. And then pull up.